Namaskar. I am Dr. Murali Manohar. Welcome to Ayurveda Samhita. In this program, you are going to learn about an important topic and some powerful ancient Ayurvedic secrets. These can change your entire life forever.
Bronchial asthma. Bronchial asthma is a common disease affecting 10 to 20% of the population. In the vast majority of cases, the disease is mild and often unrecognized. There is evidence that the prevalence of asthma is increasing. In spite of better understanding of the pathophysiological processes involved in this disease, mortality from asthma has not been influenced, and in our country, it has been increased. Asthma means twitchy airways. These narrowed airways may lead to coughing, wheezing, chest tightness and shortness of breath, symptoms often being worse at night. Invasion of allergens into our daily life is the prime cause for it. Increasing industrialization and spreading urbanization are the provoking factors for it. Surprisingly, in a majority of the cases, allopathic drugs such as beta antagonists, aspirin and non-steroidal anti-inflammatory drugs often cause acute attacks of asthma. It is often aggravated by non-specific factors such as cold air, tobacco smoke, dust and acrid fumes, respiratory viral infection and emotional stress. Asthma is a clinical condition characterized by attacks of wheezing, breathlessness and cough due to the narrowing of the air passage within the lungs. There are two types of asthma, extrinsic and intrinsic. Extrinsic asthma occurs in the younger age group. Patients are usually sensitive to pollen, house mice, feathers, food, fur, and drugs and have a family history of similar sensitivities. Exposure to the precipitating factor causes an inflammatory allergic reaction in the mucous membrane. This type of asthma tends to be sporadic. Intrinsic asthma tends to occur in older patients. It is a chronic condition. It has no apparent allergic cause or family history. This type of asthma is precipitated by bronchial infections, chronic bronchitis, strenuous exercise, stress or anxiety. Throughout the world, bronchial asthma is on the rise. Out of sheer desperation, sufferers readily fall for any wonder cure. Consequently, hundreds of traditional healers make tall claims of having found the permanent cure for asthma. Most of these healers are quacks. Bronchial asthma is a complex disorder, which needs to be treated by a qualified medical doctor. Instead of searching for symptomatic relief or a magical cure, it is always better to concentrate on predisposing conditions and causative factors. If you identify them, then you can avoid frequent attacks. Ayurvedic view. Bronchial asthma is known as Tamakas Vasa in Ayurveda. This medical science emphasizes on gastrointestinal factors apart from the respiratory afflictions to be the cause for bronchial asthma. That is why in the preliminary stage of the disease or just before its onset, the patient complains of indigestion, constipation or diarrhea. It is mainly a kapha syndrome, though differentiation of humoral types also exists. In other words, bronchial asthma can be from any of the three humors Vata, Pitta, or Kapha. Most often, the disease is Kapha in nature. Vata-type asthma is characterized by dry cough and wheezing. Additional symptoms are thirst, dry mouth, dry skin, constipation, anxiety and craving for warm drinks. Attacks occur predominantly at Vata time, dawn and dusk. Pitta-type asthma is characterized by cough and wheezing with yellow phlegm. Other symptoms are fever, sweating, irritability and need for cool air. Attacks are at Pitta time, noon and midnight. Kapha-type asthma is characterized by cough and wheezing with abundant clear or white phlegm. The lungs are often congested, producing a whistling sound. Attacks are at kapha time, morning and evening. Guidelines and Ayurvedic remedies. The treatment of asthma consists in the employment of remedies to allay the paroxysms, and in the adoption of measures likely to prevent the recurrence. According to Ayurveda, the asthma of recent origin can be treated effectively, but if it becomes chronic, it can only be managed. It is not the drug alone that can give relief from asthma, but regulation of diet and the change of conceptual thinking can also play a great role. Along with proper medication and control over eating and living, asthmatics can get better and quick results. During an acute attack, a hot chest and shoulder pack, repeatedly given every half an hour, will have a sedative effect upon the nerves and a relaxing influence generally, giving the quickest and most satisfactory relief. Hot milk or hot water, when sipped little by little, provides immediate relief from the attack. The inhalation of steam-laden air may be provided by using an ordinary tea kettle, attaching a funnel to the spout, and inhaling from the upper wide end of the cone. This is very effective in relieving spasms. In many acute attacks, relief will be found in a simple hot hand bath, or hot foot bath, immersing hands or feet up to the elbows or knees. Concussion to the cervical vertebrae from the 4th to the 7th for 6 to 8 minutes with half-minute interruptions every minute is excellent to relieve attacks. A creeping plant known as Somalata, Ephedra vulgaris, is found to be highly efficacious in relieving asthma. This grows in western Himalayas in abundance and is sent in hundreds of tons to western countries where ephedrine is prepared from it. The powder made from the whole plant, after drying in the shade, and is given in the dosage of 100 to 250 milligrams, mixed with honey or water at the intervals of 8 to 4 hours. At the time of a full attack, wrapping a hot brick in a rough cloth and then giving dry fermentation with it to the chest is found to be useful in asthma. Smearing chandonadi oil, and then giving heat fermentation is also good. Turmeric paste used as poultice on the chest or warming the chest with it is very soothing. Only the use of pipali, piperlongum, powder along with pure honey, makes an attack of asthma subside. The rhizomes of turmeric are to be baked in hot sand slightly and made into fine powder. This is to be taken 3 grams twice a day with sugar. The dose can be increased up to 10 grams in due course. During an acute attack of asthma, drink some hot water with the juice of 1 clove of garlic. Take the juice of the whole plant of Solanum serratense, chocoteri, 7 to 14 milliliters as such, or with tricatu, equal parts of dry ginger, long pepper and black pepper. 1 gram twice a day. You can even take Terminalia bellerica powder. Bahida, 3 to 6 grams with 4 to 6 grams honey twice a day. Mustard oil, Saracen, is a good remedy. Take a spoonful with jaggery twice a day. If you wish to use a compound formulation, then here is a medicine for you. Prepare a decoction by boiling equal parts of root of Adito devasica, Adusa, rhizome of turmeric, stem of Tinospora cordifolia, Giloa, and the fruit of Solanum serratense chocoteri. Take this decoction internally, 14 to 28 milliliters with 1 gram of powdered black pepper twice a day. Smoke leaf of Datura stramonium, Datura. This gives instant relief but needs medical supervision. Specific medicines, Kapha Kartari. This cuts the kapha like scissors, hence the name. About 200 milligrams of this powder is to be wrapped in a betel leaf and chewed slowly. As soon as the saliva mixes with the powder and reaches the stomach, its effect will be clearly felt. Even when the attack subsides, 4 doses of it are to be taken for the next 24 hours. Bharanghi Gouda, it is a good remedy for asthma. It also relieves all types of coughs. A dose of 12 grams is taken together with 1 boiled fruit of hariteki, Harad or Terminalia chibula, Kanikasava. It is a proven medicine for asthma and allied complaints like cough, tuberculosis, bronchiectasis, chronic fevers and hemoptysis. The principal ingredient in this preparation is Kanaka, deuterostramonium, which has been a reliable drug for asthma. 10 to 30 milliliters of this medicine is to be taken twice a day after meals. Chiavanapraza and Agathia raceyiana. The main ingredient of the former medicine is amla, the richest source of vitamin C in nature. A peculiarity of this fruit is that its vitamin content is not lost by exposure to heat, as is the case with other drugs and fruits. The latter preparation is indicated in cases of asthma where the patient is constipated. However, Chiavanapraza is the better remedy. Both the medicines can be taken in 1 teaspoonful doses thrice a day, preferably before food intake. They are slow-acting remedies but are sure in the efficacy. In chronic cases, their effect is evident from the increasing gap between successive attacks. Citopilati churna. This should be taken 3 or 4 times a day in 1 teaspoonful dose with honey. Since the drug is likely to cause irritation of the throat, it is better when mixed with honey and taken as a linctus. During acute attack. In severe cases, any of the following medicines can be tried with the advice of the physician. Swasakaza Chintamani Rasa, Swasakatara Rasa, etc. In case a patient has a long history of asthma, and other complications are present, the Panchakarma therapy of Ayurveda gives satisfactory results. Diet and other considerations. Avoid foods that can aggravate asthma. Common foods, which trigger asthma, are animal foods, milk products, food items which take more than 2 hours to digest, mucus-producing foods such as curd, bananas, sugar, sweets, black gram, etc. Drink plenty of liquids, 8 to 10 glasses a day, to keep secretions loose. Find out what triggers your asthma, and get rid of things that bother you at home and work. Upper respiratory infections, either viral or bacterial, often trigger an asthmatic attack. Exposure to smoke, perfumes, paints, or other strong chemical odors are common culprits. Change in weather, exposure to molds, animal dander, grass or tree pollen triggers asthmatic attacks. Certain food colorings and preservatives may trigger asthma. Drugs, such as aspirin, non-steroidal anti-inflammatory drugs, beta blockers, ACE inhibitors can precipitate an asthma attack. Make a special effort to keep your bedroom allergen-free. Sleep with a foam or cotton pillow, not a feather pillow. Use a plastic cover over the mattress. If possible, wash your mattress in hot water every week. Dust your room often, but not with a broomstick. Vacuum cleaning is the better option. Wear a dust filter mask when you do so. Avoid using perfumes. Wear a scarf round your mouth and nose in cold weather. Doing so will warm the air as you breathe in and will prevent cold air from reaching sensitive airways. Mild exercise, like swimming, is good for asthmatics. However, some asthmatics are allergic to chlorine, which rules out swimming in a public pool. During an asthma attack, sit up straight or bend forward. Do not lie down. If you have an air conditioner, change its filter regularly. Make a paste of rock salt and old ghee or mustard oil. Rub it on the chest. Alternately, you can massage Saint Devati Talam on the chest. Place a hot towel over the chest. This helps to relax muscles and restore normal breathing. For an acute asthma attack, try steam inhalation. Add a few drops of eucalyptus oil in a bowl of hot water. Cover your head in the bowl with a towel. Be careful that the water is not so hot that the steam burns your face. You should not suppress natural urges like urination, thirst and cough. In addition, you must avoid smoking and moving in the sun. It may be useful to assess the alignment of your spine. Often the upper 3 vertebrae are not in alignment with the spine after an asthmatic attack. This ultimately puts greater pressure on the lungs and possibly precipitates another attack. Getting a professional massage, specifically between the shoulder blades with Shandana Lakshaditala, can reduce the frequency of attacks. Yoga benefits asthmatics. The integral yoga approach to asthma includes correction of distorted posture and faulty breathing habits, methods for the expectoration of mucus, teaching a system of general muscle relaxation, techniques for the release of suppressed emotion and for reducing anxiety. In yoga, the purpose of functional breathing exercise is to learn to engage both abdominal muscles and the diaphragm in breathing. The duration of exhalation should double the inhalation. During the process of breathing, you must learn to relax asanas such as Surya Namaskara, Shashanka-asana, Pranamasana, Sarvangasana, Saptavajrasana, Ushtrasana, Hasthavathanasana, Vithatalola asana, Dvikona asana, Matsya asana are helpful. Pranayamas like Nadi Shodhana, Bhastrika, Kapalabhati are beneficial. If you want to try some higher range of yoga procedures, Shata karmas, such as Vastradathi, Shankha Prakshalana, Jalanethi are considered therapeutic. Other yoga-related aspects like Yoga Nidra, Antarmana, meditation and relaxation techniques are useful to remove the source of nervousness. The first and foremost thing is to keep the bowels regular. Constipation should not be allowed to supervene. Exposure to cold should be avoided. Edibles, which are hard to digest, should also be avoided. The supper should contain easily digestible and light food. It is better if the food is taken before sunset. Boiled water should invariably be taken. If milk increases coughing or phlegm, it may be boiled with equal quantity of water and 2 or 3 numbers of pipali, long pepper, crushed and ground. Curd, buttermilk, bananas, guavas, and fried foods are to be avoided. All sour substances should be banned. Smoking, both active and passive, should be strictly prohibited. Allergens and other substances liable to provoke attacks of asthma are to be avoided. For example, pollen may be avoided by not being exposed to flowering vegetation and closing the bedroom windows. Mites and house dust may be prevented by cleaning mattresses and blankets with vacuum cleaners. Animal dander is best avoided if contact with dogs, cats, horses or other animals is avoided. It will be good if feather pillows are substituted with cotton pillows. Often, allergens are produced from certain foods such as fish, eggs, milk, yeast and wheat. These should be carefully identified and eliminated from diet. Exposure to chemicals is to be avoided. If it is not possible, it is better to change the profession. In addition, indiscriminate usage of chemical pain-relieving drugs should be avoided. Physical and mental stress should be avoided. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will meet with another interesting and important topic. Satam Jiva, Sarado Vardhamanaha. Satam Hemantan, Satam Vasantan. Live over 100 years old with excellent health and complete happiness. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.